Good afternoon, everyone. We will be starting the session within the next couple of minutes. Hello, everyone. Panelists, can you please turn on your cameras? Hello, everyone. Marhaba. Welcome to this webinar on Amman's COVID-19 urban response, jointly organized by the International Growth Center and the Greater Amman Municipality. This event is bilingual. It will be delivered in both English and Arabic. To move from one language to another, please click on the interpretation icon below. للتواصل على قناة العربي الرجاء الضغط على أسفل الشاشة عند أيقونة الترجمة. My name is Sandra Hiyari, Country Advisor at the IGC. I will moderate today's session. The IGC provides demand-led policy research to policymakers in developing countries and is largely funded by the UK Foreign, Commonwealth and Development Office, the FCDO. The IGC is based in LSE and runs in partnership with the University of Oxford. Currently, the IGC is active in Jordan, and we would like to invite you to check our country webpage by visiting www.theigc.org. This event will be looking into challenges cities are facing amid the pandemic and potential recovery measures as a continuum to a rolling conversation here at the IGC. Today, we will look at the city of Amman and the various institutional measures it undertook in its response over the COVID-19 outbreak. Before we get started, let's review a few housekeeping items. All attendees have been muted to minimize background noise. We will begin with a discussion with speakers before opening up to a Q&A from the audience. We're going to have a designated time at the end of the panel discussion to answer questions. So please type in your questions in the Q&A box at the bottom of your screens. We are recording today's session, and a video and audio recording will be made available on IGC's website. We would like to thank the Center for the Study of the Built Environment for their role in publicizing this event, as well as our other partners. Without further ado, let me introduce you to today's first speaker, Patrick Lamson Hall. Patrick is an urban planner and a research scholar at the NYU Stern Urbanization Project. He has contributed to the development of the Atlas of Urban Expansion in its 2016 edition. He also manages the India Urban Expansion Observatory in Mumbai, India. Patrick holds a master's degree in urban planning from the NYU Wagner School of Public Service and is currently a PhD candidate at the Wagner School. I would like to begin with asking you, Patrick, what is the role of planning generally and urban density specifically in the face of pandemics.
Thank you. Thank you so much for the opportunity to participate in this great panel. I think it's really wonderful that IGC is working to make the connection from the local scale to the global scale through this. This is really, really excellent. Can you go to my next slide? Thanks. So I call this the view from 30,000 feet just because I don't know very much about Amman. The perspective that we tend to take at New York University is a very top level one because we're interested in identifying norms and trends that can be generalized into different environments. So in the case of COVID-19, when we think about COVID-19 in cities in a general sense, there's basically a few broad types of information that we have. We can say something about density, we can talk about crowding, inequality, city size, and this really amazing emergent phenomenon that's called the urban health advantage. Next slide. Could you go to the next slide? Great. So when it comes to population density, it's very interesting because when we look at data from cities around the world, and there's starting to be actually quite a lot of this data available, we find that there's not a direct relationship between density and COVID-19 transmission. And this is often surprising to people because it would seem intuitive that if you have more people in a given area, you would wind up with more transmission. But interestingly enough, the nature of this virus, like as a respiratory virus that spreads much, much more indoors, what really matters is not density, it's crowding. And these are two distinct things. So density basically measures people at the ground level when we talk about the kinds of density that's typically being compared. Crowding measures people over built up area. So how much interior space do people actually have? So if you think about it, it does actually make sense that crowding would be explanatory for COVID-19 transmission. And we can see this really clearly in seroprevalence results that are coming up from cities. These are situations where they've done random sampling to try to measure the exposure of the population to COVID-19. And we can see very clearly that there's not a density association, but there is a crowding association. So from a planning perspective, people should be concerned about crowding in homes, definitely, but also in public places like streets, businesses, workplaces. Can you go to the next slide? So needless to say, this has implications when we think about inequality. I mean, in most cities where there's data, the virus has concentrated in lower income areas. Those are the areas that have seen the greatest transmission, even if they're not the areas that have seen the most deaths. So why is this? Well, again, it comes down to crowding. I mean, in a city, the poor people are usually the people who have the fewest options about where they're going to live and how they're going to live. And especially in cities that have been experiencing increases in housing prices or declines in income, and that describes many cities around the world right now, either one or the other, people really wind up trading space for location. So they would rather be in places where they can easily access jobs and services than have like maybe a bigger house that's less well located. Sorry, could you go back? What can we do about this? Can you go back to the slide about inequality? Thank you. So in these areas, it's hard to do something about the floor space in private space. Like it's hard to give people more space in their homes because this is something that's typically paid for by individual households. It can be difficult to intervene in that market in like a short-term way. What we can do is we can look at public spaces. So this is really the role of the municipality, the laying out of streets and roads and public open spaces. And we can look at businesses and managing crowding in businesses. Okay, now go to the next slide. Let's try it again. Another thing that we have learned since the pandemic started and that we can demonstrate statistically is that bigger cities with more connections got hit by the pandemic first. And interestingly, these cities have more density than smaller cities. So they had like two things kind of working against them. One was that they're more likely to have these crowded conditions, and the other is that they experienced the onset of the virus sooner, before people really knew how to treat it, really knew how to manage it. But they have another thing going on, which is that they have more resources to fight the virus. They have more skilled administration, they have more emergency workers, hospitals, clinics, money in the city. There's more than you would find in rural, smaller areas. So if you look at this on balance, what you find is that it's actually better to be in a big city, even a really dense city, than it is to be in a smaller city or a rural area, in terms of getting the virus and in terms of whether or not you're going to get very sick and die. And what that looks like statistically is just that larger cities have a smaller than expected number of cases and deaths than smaller cities. And we can see this now because we have kind of this 11-month timeline. So what that means is that there's this thing that we're calling the urban health advantage. And this is shown up in other data like mortality and morbidity statistics as well. And it just means that in a city, you're more likely to get treated, you're more likely to have your illness detected, and you're more likely to survive. So this is something that, again, is kind of a counterintuitive finding. You would think that it's like the plague in the 14th century, and you would want to go to your villa in the country and wait it out. It turns out it's actually better, even if you're a poor person, to go and be in a city. So next slide. So with this data, what can you measure? You can measure the vulnerabilities that are in the built environment. And these are vulnerabilities that were there before. Now they're just kind of manifesting. So you want to know, how much room do people have? How much street space, sidewalk space do they have? What do their public spaces look like? How crowded are the public spaces? And then the interior spaces, are people, and this should all be measured by neighborhood, are people looking at like extremely crowded conditions in stores, extremely crowded conditions in housing? It lets you highlight areas that require interventions. Then you can push assistance into them. Then other more obvious vulnerabilities, what neighborhoods don't have access to public health, what neighborhoods don't have access to sanitation. But you can really only do this in a good way if you have good baseline data. So kind of like how the vulnerabilities that are driving COVID-19 in poorer areas were there before the pandemic, if you go into the pandemic without good baseline data, it can be very difficult to generate that data on the fly, and very difficult to say anything meaningful about how COVID-19 is spreading if you don't know how many people are in an area. And key to this is making sure that you have data for the places that, like, to put it bluntly, the places that you don't care about. So you can see the example of Singapore, where they had this really amazing trace and control strategy that completely ignored their guest workers, or didn't seriously consider them as like citizens who needed to be managed. And where did their outbreak start? Well, it started in the guest worker quarters. So in a city that has a different structure, it's going to be in the informal areas. In New York, we have areas in Queens, which is where I am. In New York, we have areas in Queens where we know people are living, 20 or 30 in a single family house, heavily subdivided, highly informal, completely ignored by the municipality. Guess what? There was a lot of COVID in those houses. So focusing on informal areas, impoverished areas is really key here. Next slide. And just to kind of conclude, so what can you do about this? Well, really, we're talking about short-term and long-term measures. So in the short term, you need to identify high-risk areas and crowd resources in. And in the long term, what you need to do is recognize that many of the things that are like driving the creation of these high-risk areas are under the control of the municipality. So when the municipality passes a regulation that makes it more costly to build housing, for instance, that's something that in the long term is going to hurt the supply of floor space in poor areas. When the municipality makes a decision not to regularize an informal settlement because it's too costly and they don't vote, that's a decision that in the long term increases your vulnerability to these kinds of pandemics. When they make a decision to adopt a strategy that goes against the evidence, like a very typical one is a strategy that says the city's not going to grow. What you're doing there is you're making a decision not only about the footprint of your city, but also about how much space people are going to have within it. So really taking a comprehensive approach and just like, again, in the medium and long term, what we can take away from this COVID-19 pandemic is an understanding that the urban planning decisions that we might make based on budget or political expediency can also have real long-term public health consequences, and not only for the people who live in those neighborhoods, which I think is kind of how maybe it's been rationalized in the past by political actors. So these are my view from 30,000 feet. You can just go to the last slide if you want. That's all I've got. So thank you so much, Sandra.
Thank you, Patrick, for capturing these insights within a brief time period. I will now move on to our second guest for today, Nuha Qtaish. Nuha currently serves as the Executive Director of Planning at the Greater Amman Municipality. She has previously served as the Director of Planning at the municipality and the head of the Zoning Directorate, and she was part of the Amman 2025 Master Plan team. Nuha has contributed to authoring both the Amman Zoning Bylaw and the Amman Municipal Law. Nuha, Jordan has implemented strict lockdown measures between March and June 2020 in the wake of the spread of the pandemic. As Jordan's capital and its most populous city, Amman was at the heart of this response that we have seen. Can you please share the experiences of Amman and walk us through the main administrative and challenges that you have faced and the successes as well? Thank you.
شكرا ساندرا. صباح الخير، مساء الخير للجميع وين ما كنتوا بهذا العالم. بداية اسمحوا لي أني أنا أشكر IGC وشركائهم والعاملين على تنظيم هاي الورشة وإتاحة لنا الفرصة لمشاركة تجربة مدينة عمان كمؤسسة وكمدينة في مواجهة الجائحة. فشكرا لكم باسم أمانة عمان وأمين عمان ومدينة عمان وباسمي أنا شخصيا. شكرا. إن شاء الله رح نستعرض اليوم الأداء المؤسسي واستجابة مدينة عمان للجائحة. Next please. موسى. بشهر 4 أو خلينا نحكي ببداية العام، بداية ظهور الجائحة، وكانت كل دول العالم في عز الاستجابة لهاي الجائحة، دعا معالي أمين عمان لاجتماع طارئ وشكل فريق عشان يوثق الإجراءات المؤسسية اللي قامت فيها أمانة عمان للاستجابة للكارثة أو للجائحة اللي صارت، ولا كمان دراسة استجابة المدينة ومناعتها في مواجهة الجائحة. فشكل فريق، أنا تشرفت الصراحة برئاسة هذا الفريق، كان معنا أعضاء من كافة قطاعات الأمان لحتى نوثق هاي الإجراءات ونشوف وين نقاط الضعف ونقاط القوة اللي قمنا فيها ونعمل معايير لقياس الأداء. Next. رح نستعرض اليوم بعض العناوين من التقرير، العناوين الرئيسية والتحليل اللي قمنا فيه لأداء لمنعة المدينة، اللي رح يركز على النقاط اللي ذكرها باتريك في العرض الأولاني. بداية رح نتعرف على مدينة عمان، يعني ناخذكم جولة هيك في المدينة تعريفية سريعة. مدينة عمان هي عاصمة المملكة الأردنية الهاشمية، بتغطي مساحة 800 كيلومتر مربع، يقطنها 4 ملايين نسمة، يعني بتشكل 40% من سكان المملكة ساكنين في مدينة عمان. هذا بيعطينا تخيل حجم أهمية هاي المدينة سياسياً واقتصادياً واجتماعياً. تعرضت لموجات لجوء متعددة، آخرها كان موجة اللجوء السوري. من عدد اللاجئين اللي إجوا للمملكة المسجلين عم نحكي 30% منهم سكان مدينة عمان، وهذا تحدي آخر تنظيمي وتخطيطي وإداري واجتماعي واقتصادي للمدينة. تخطيطياً المدينة 48% من أراضيها داخل التنظيم، يعني إلها صفة استعمال وإلها دور، والباقي اللي هو واضح باللون الأزرق على الخريطة هو واقع خارج التنظيم، لا يعطينا مساحة لتطوير المدينة. لاحقاً 37% من المدينة مبني أو built up. نروح على المؤسسة ناخذ تعريف فيها. Next please. إدارياً مدينة عمان مقسمة ل 22 منطقة إدارية لتحقيق اللامركزية في إدارة المدينة، لأنه بهذا الحجم مدينة بدها إدارات جيدة وحكيمة. مؤسسة أمانة عمان الكبرى هي بلدية بمعنى بلدية، وهي مؤسسة ذات استقلال مالي وإداري، برأسها مجلس منتخب، ثلثينه منتخب والثلث الآخر معين تعيين، ضمنهم معالي الأمين، نتبع إدارياً لرئاسة الوزراء. بتضم فيها 5 قطاعات إدارية. Next slide please. Next موسى. إدارياً مقسمة ل6 قطاعات إدارية لحتى تمكنها من أداء مهامها الموكولة إلها. عدد الموظفين فيها قرابة 24,000 موظف. خلال فترة الجائحة عمل منهم فقط 32% تبعاً للإجراءات اللي كانت مأخوذة، زي ما تفضلت ساندرا أنه كان في إجراءات حكومية قررت الحظر الشامل، منع الناس من الخروج من المنازل، ف32% فقط من الكادر كان على رأس عمله. فجميع المهام اللي قامت فيها الأمانة كانت بهاي النسبة من العاملين. Next please. إن شاء الله بالجزء الأول من العرض رح نتطرق للأداء المؤسسي. طبعاً أمانة عمان كان في إلها مهام منفردة عن بقية المؤسسات وردت في الخطط الوطنية، يعني في إلنا دور كان محدد في الخطط الوطنية لمواجهة الأوبئة. في عام 2016 عند تأسيس المركز الوطني لإدارة الأزمات تم وضع خطة وطنية لمواجهة الأوبئة. ب2020 نظراً لمستجد الجائحة وضعت خطة وطنية لمواجهة وباء كورونا تحديداً، تحددت لأمانة عمان من ضمنها مهام معينة. طبعاً الأمانة بدورها وضعت خطط تنفيذية بكل تفاصيلها بالموارد الموجودة لتنفيذ هاي المهام الموكولة إلها، بالإضافة لأي مهمة كانت طارئة تحدث بهذا الوقت. كل تفاصيلها موجودة بالتقرير اللي أعديناه الفريق، رح أحكي عنه في نهاية العرض. طبعاً الأمانة كبلدية خلينا نحكي لكل البلديات، قدمت الدعم للبلديات كلياتها بهذاك الفترة، سواء بالخبرات أو بالمواد العينية. وضعت استراتيجية، كان هذا أمر طارئ لإدارة النفايات الخطرة أو النفايات الطبية اللي كانت في مناطق العزل أو مناطق الموبوءة أو بأماكن الحجر. أعادت دراسة كل أولويات الخدمات اللي فيها لمواجهة أي طارئ ممكن يجي لاحقاً، إيش الخدمات اللي لازم تستمر وإيش اللي لازم يتوقف. أضافت خدمات جديدة للخدمات الإلكترونية، وفعلت الخدمات الضرورية اللي المواطن لا يمكن أنه يستغني عنها خلال فترات الخطر أو الأوبئة. أعدت برامج توعوية للمواطنين من خلال قطاع التنمية الاجتماعية ومشاركات سواء لربات المنازل أو للأطفال، تعليم عن بعد، كلها بتفاصيلها موجودة بالتقرير. كمان يعني عملت بمشاغل الأمانة على صناعة أجهزة للتعقيم. يمكن بالسلايد القادم ممكن نشوف بعض الصور للإجراءات اللي عملتها الأمانة. Next please موسى، عشان الوقت كتير قليل. هاي بس عينات من الإجراءات اللي عملتها الأمانة. إحنا خلال كتابتنا للتقرير طلعنا بمؤشرات محلية لقياس أداء القطاعات الأمانة لحتى كل إدارة تتمكن من متابعة إنجازاتها وين التراجع اللي صار أو إذا في تقدم أو إيش استمر، ويضل دائما في مؤشر لقياس الأداء سميناها المؤشرات المحلية لأمانة تعني لكل دائرة. هذه فقط عين منها، هي مؤشرات كثيرة لكل القطاعات. Next please موسى. طبعا خلال فترة الجائحة الأمانة عملت على المشاركة المجتمعية لقياس الأداء اللي هي عملته أو قياس الرضا المجتمعي. فوزعت استبيانات إلكترونية على المواطنين، أخذت رأيهم بالخدمات اللي كانت مقدمة، ومنها كانت خدمة صراحة هو إجراء غير مسبوق اللي هو عملته الأمانة، إنها حددت أوقات لجمع النفايات من المنازل. فعملنا قياس رضا للمواطنين عن هاي الخدمة، وكان يعني علشان تشوف الأمانة إنه هل تستمر بتحديد أوقات لجمع النفايات ولا تتوقف عن ذلك، ومنها عمليات التعقيم اللي قامت فيها. زي ما نعرف الأمانة قامت بتعقيم المدينة كاملة عدة مرات خلال الأسابيع في بداية الجائحة، فكانت المشاركة المجتمعية صراحة فاعلة في قياس الأداء وتطوير الخدمة ودراسة وين نقاط الضعف اللي كانت موجودة والقوة. الأثر المالي للجائحة كان صراحة كبير كتير على المؤسسة، فيعني أكبر أثر كان في الإيرادات الأمانة بنفس الفترة اللي هي من 18/3 ل 10/5، هي الفترة القياسية لأي بيانات رح تشوفوها عندنا في البرزنتيشن اللي هي فترة إعداد التقرير، نزلت 90% مقارنة ب 2019، وهذا كان يعني أثره واسع على النشاطات الأمانة، مما اضطر الأمانة أو تطلب منا أن نأخذ إجراءات تحفيزية للمواطنين، من تخفيض على الضرائب الأبنية، إعفاءات من الغرامات. طبعاً هاي القرارات كانت بالتعاون مع الحكومة لحتى تحفز الناس إنها تدفع مستحقاتها المالية للأمانة. الإيرادات نزلت بنسبة 90%، بينما النفقات نزلت فقط ب 57%، لأنها استمرت الأمانة بدفع المترتبات اللي عليها المالية للمقاولين أو للعطاءات. أغلب المشاريع الرئيسية استمرت في العمل وما توقفت، مثال على ذلك مشروع الباص السريع. Next please موسى. دراسة منعت المدينة خلال الجائحة، أو كيف مدينة عمان استجابت للجوائح. خلال السنوات الماضية أمانة عمان أصدرت عدة استراتيجيات متعلقة في منعة المدينة. كان بدايتها استراتيجية منعة المدينة، وانبثق عنها عدة استراتيجيات لتنفيذ هاي الاستراتيجية، منها استراتيجية أو خطة أمانة عمان للتغير المناخي، وخطة الجي كاب الجرين سيتي أكشن بلان. هدول الخطط تم عليهم كمان مراجعة لإعادة ترتيب الأولويات والمبادرات اللي واردة فيهم. كان طبعاً فيهم محاور كثيرة لتحقيق موضوع التنمية المستدامة، وعمان مدينة منعة كان أهمها النقل المستدام، اللي كمان شوي رح نتطرق لتحليل كيف إحنا ممكن نحقق هذا الهدف. الطاقة النظيفة، ففيها تفاصيل كثيرة الصراحة، يعني اللي عنده حب لهذا الاطلاع ممكن، هاي كليات الوثائق موجودة على موقع الأمان. Next please موسى. عملنا اكسرسايز صراحة كان لطيف جدا خلال فترة الجائحة، هو أحد أدوات تحليل أثر الجائحة على المدينة. في بداية الحظر منعوا الناس من استخدام السيارات، وكان الحصول على الخدمات بس عن طريق المشي، وسكرت معظم الأنشطة اللي موجودة في المدينة. أخذنا قياسات تلوث الهواء من 6 محطات موجودة بمدينة عمان خلال 4 أسابيع. بنلاحظ بالخارطة كيف الأثر على نقاوة الهواء، خلينا نحكي، ونوعيته. بعد 4 أسابيع أصبح تقريباً الهواء نقي تماماً. هذا بيخلينا نفكر إنه توجهنا للنقل المستدام وللطاقة النظيفة كم الأثر السريع اللي رح يكون على نوعية الهواء. فبصراحة هاي كانت يعني تمرين جميل، كان هو بداية التفكير ب كيف ممكن عمان تكون مدينة خضراء ومدينة منعة ومدينة مستدامة. Next please. لتحليل استجابة المدينة للكوارث اتخذنا مسارين. المسار الأول كان مسار مكتبي، اللي هو تحليل قاعدة البيانات وما يتوفر لدينا من معلومات على الأجهزة تبعنا. والمسار الثاني اللي هو كان مسار ميداني. بالنسبة للمسار المكتبي، أول شيء لازم نطلع عليه اللي هو الكثافة السكانية، على إيش إحنا، وين موجودين الناس اللي إحنا بدنا نخدمهم، عشان بعدين التحليل اللي كمان تطرق له باتريك، اللي هي الكراودنس الموجودة في المدن وين توزيع السكان فيها. إحنا مدينة عمان من خلال الخرائط ثلاثية الأبعاد اللي أنتم شايفينها، القراءة بتصير واضحة جدا إنه في تفاوت كبير، وتوزيع الكثافة فيها غير متساوية، بتفاوت ما بين شخص في الكيلومتر المربع في المدينة المتروبوليتان، أو خلينا نحكي في المناطق الطرفية، ل 48,000 شخص على الكيلومتر المربع في المناطق الشرقية، وتحديداً منطقة ماركا. فهذا يعني المعايير دراسة الأحياء لاحقاً ما رح تكون متساوية أو متشابهة، كل حي حسب كثافته بنوضع له معايير. هذا كمان بيأكد إنه الدراسة على مستوى الأحياء هي أصبحت حاجة ملحة، والتفكير بالساكن الموجود داخل الحي أصبح أساسي، مش بس إنه نطلع على مستوى المدينة الكبرى، لا، لازم نطلع على أصغر سكيل موجود فيها وننظر له بخصوصية عالية. التحليل الثاني اللي قمنا فيه مكتبياً، طبعاً اعتماداً على قواعد البيانات الموجودة عندنا. Next slide please موسى. اللي هي خرائط GIS، خرائط البنى التحتية. Next please. التحليل الثاني اللي قمنا فيه اعتمدنا على خرائط GIS الموجودة عندنا، اللي هي بتنقل واقع الحال والخرائط التنظيمية. استخدمنا ArcGIS Toolbox لتحليل الشبكة الحضرية. استخدمنا أداة مطورة من قبل City Form Lab، اللي أعتقد إنه كان نشاط مشترك ما بين هارفارد يونيفرسيتي والMIT لقياس الوصولية للخدمات الحضرية، لأنه خدمة الفرد وسهولة الوصول للخدمة أصبح حاجة ملحة وضرورية جداً. هاي الأداة مكنتنا من دراسة وتحليل كافة الخدمات اللي موجودة داخل مدينة عمان، سهولة الوصول إلها، هل هي موزعة صحيح، هل هي كافية ولا غير كافية. طبعاً الخرائط أعطتنا قراءة بدي أحكي يعني دقيقة جداً. هلأ راح نحكي لاحقاً كيف تأكدنا منها، وإنها فعلاً بتمكنك من إيجاد حلول مبنية على الأدلة، اللي هو Evidence Based Solutions. هلأ هاي الخرائط مكنتنا من دراسة الوصولية للخدمات. بإمكانك باستخدام هاي التول تضيف فاكتورز. إحنا حطينا فاكتور ووكابيليتي اللي هو 600 متر، اللي هي المسافة المقبولة للمشي. أضفنا فاكتور التوبوغرافي اللي هي بتتميز فيه طبيعة مدينة عمان. هدول الخرائط اللي احنا أطلقنا عليهم اسم الهيت مابس أو الجرافيتي مابس مكنونا من إعادة التفكير وإعادة النظر لآلية توزيع الخدمات داخل مدينة عمان. بيعطوك بالضبط كل نقطة هل في إمكانية للوصولية إلها ولا لا، كل بناء قائم موجود، وإيش ممكن أنت توجد حلول فيها. طبعاً إحنا حللنا كافة الخدمات. الخرائط اللاحقة إذا سمحت موسى، السلايد اللي بعده، حللنا كل الخدمات اللي موجودة في الأمان، الخدمات الحضرية الموجودة داخل مدينة عمان، منها المراكز الصحية، الخدمات الطبية، المستشفيات، الخدمات التجارية المحلية. Next slide please موسى.
We have 2 minutes left please for this presentation.
Yes. Okay. الوصولية ممكن نمشي عليهم هدول سريعاً لكل الخدمات الموجودة. بالإضافة حللنا البنى التحتية اللي موجودة، وين خدمات الصرف الصحي إلى آخره، باعتماد على قواعد البيانات الموجودة عندنا. Next please. Yes. هلا هون بس زوم إن كيف هاي الخرائط رح تساعدنا بإيجاد الحلول. أخذنا هاي بس صورة هيك بتوضح صورة موقع معين بمدينة عمان، ببين لنا الصورة الجوية بتبين المباني القائمة. الخارطة الثانية بتبين وين مواقع البقالات الموجودة فيها داخل منطقة السكن. الخريطة الثالثة أو reachability map، خريطة الوصولية، بتبين لنا إمكانية الوصول لهاي الخدمة الموجودة اللي هي البقالة الموجودة داخل الحي. يعني من نظرة بسيطة بنشوف إنه في عدد كبير من البقالات، لكن الوصولية لهم واضح إنها مش سهلة، يعني مش كأن تحقق الغاية اللي موجودة منها. هذا بتطلب إنه إما أنت لازم تحدث شبكات نقل إضافية في الحي، أو تعيد توزيع هاي الخدمات بحيث إنك تخدم كل السكان الموجودين ويقدروا يحصلوا على هاي الخدمة بسهولة وباستخدام المشي فقط. إذا بدنا نحكي عن نقل مستدام، معناته احنا لازم نخفف من استخدام السيارة، نتوجه للطاقة النظيفة. أكثر طريقة مستدامة للتنقل اللي هي المشي على الأقدام. لما نحكي عن حي، معناته أنا لازم كل الخدمات اللي فيه أوصلها ضمن مسافة مشي معينة قدر الإمكان. هذا يعني بتطلب منا إعادة النظر يعني إعادة النظر في آلية التخطيط وآلية التخطيط الحضري على مستوى الأحياء. Next please. طبعا إحنا عشان نعزز الدراسة تبعنا وزعنا استبانة إلكترونية أو استطلاع للرأي، سألنا الناس تحديداً عن الخدمات الحضرية، عن وجود حديقة أو لا في الحي اللي أنت ساكن فيه، في خدمة تجارية، في مخابز، في صيدلة، بكل تفاصيلها، كيف كنت تحصل على الخدمة، هل كنت تمشي مشي بالسيارة باستخدام الدراجة الهوائية، إيش مقترحاتكم أنتم يا سكان الحي لحتى إنه نحسن هاي الخدمة الموجودة. طبعا من خلال الاستبيان بدعم التحليل المكتبي اللي احنا عملناه اللي حكيته سابقا. هلا هذا النتائج الميدانيه المشاركه المجتمعيه عززت التحليل الاولاني، عشان هيك بحكي انه كانت الخرائط مستوى عالي من الدقه. نتيجه انه 87% من الاحياء مخدومه فيها الخدمه التجاريه، ولكن هل الوصول لها كان سهل؟ بنلاقي انه لا، 55% فقط من الناس حصلوا على الخدمه مشيا على الاقدام. لو مشينا تحليل اكثر، احنا هذا الاستبيان حللناه ونزلناه على خرائط يعني تفصيليه جدا، انه 55% من الناس حصلوا على الخدمه مشي، ولكن مشوا مسافه اكثر من 500 متر، من 500 ل 800، وفي ناس مشوا اكثر من 800 لحتى يحصلوا على الخدمه، يعني ممكن يكون وصل للحي المجاور لحتى انه يحصل على خدمته. فالدقه اللي بيعطينا اياها الخرائط، الاداه اللي استخدمناها الUNA مع الاستبانه ممكن تعطيك حلول فعلا مبنيه على الادله وتكون واقعيه ومنطقيه وقابله للتطبيق. Next please. طبعا من الدروس اللي next please. الدروس المستفادة خلال الجائحة كانت صراحة كتيرة، بس من نواحي تخطيطية خلينا نحكي إحنا كمخططين إيش الدرس اللي تعلمناه خلال مواجهة المدينة وخلال تعرضنا لهاي الجائحة المفاجئة اللي ما كان أبداً أي حدا محضر حاله إلها. إنه الخدمات الحضرية اللي بيحتاجها الساكن الحي لازم النظر إلها بعناية وكفاية، ونتأكد إنه كل شخص توصل الخدمة في الوقت المناسب وعند الحاجة وبالآلية المناسبة دون مواجهة أي صعوبات. دائما استخدام الأدوات الحديثة بيعطيك حلول ناجحة وبيعطيك إمكانية لصناعة قرار مناسب في الوقت المناسب. منعت أي مدينة هي قدرتها على مواجهة الكوارث، بس المنع الأكبر اللي هي قدرتها على التنبؤ لحدوث الكارثة وتكون جاهزة لمواجهة هاي الخطر اللي بده يجي عليها. فرفع الجاهزية والتجهز لمواجهة أي حادثة ممكن تصير بيزيد من مناعة المدينة. المشاركة المجتمعية أساس أي حل تخطيطي لازم تحطه، لازم يكون مبني على مشاركة الأفراد اللي هم بدهم يستخدموا هذا الحل عشان نمشي لقدام. بس شوي بدي أحكي عن هاي الخارطة. إحنا كمان ظهرت عندنا ظاهرة بمدينة عمان خلال فترة الجائحة لاستخدام الدراجة الهوائية، وهي الصراحة كانت ظاهرة جميلة جدا. فكان واحد من الأسئلة عشان نشوف وين المناطق اللي استخدموا، أخذنا هاي الإجابة وحاليا عم نعمل عليها لإيجاد مسارات للدراجات الهوائية في مدينة عمان أينما أمكن. يعني هذا مشروع جدي قائم فيه. كمان كتير مشاريع يعني حاليا الأمانة من توصيات التقرير عم تعمل عليها. عم نعمل على المكتبة الإلكترونية المجتمعية، هذا مشروع حاليا لاحق تحويل مكتبة عمان اللي كلنا بنعرفها بوسط البلد لمكتبة إلكترونية حتى الناس كلها تتمكن من الحصول على اللي بدها إياه. كتير في مشاريع حاليا قائمة. فكرنا بإنشاء مختبر للمدينة السيتي لاب، وحاليا كمان هذا مشروع عم نتعاون مع جهات أكاديمية وجهات مختصة لحتى نوجد بؤرة لإنشاء مختبر للمدينة أو مركز حضري للمدينة لتحليل البيانات وإيجاد الحلول والقرارات بالوقت المناسب. نتطلع إنها عمان تكون مدينة مش بس مناعة، مدينة مناعة مستدامة. طبعاً نعمل حالياً على تحقيق أهداف التنمية المستدامة حسب أجندة الأمم المتحدة 2030 بناءً على الحلول التخطيطية المبنية على الأدلة عم نعمل حالياً على تحقيق مبدأ اللي هي الأحياء المتكاملة، ممكن نحكي self-contained أو self-sufficient neighborhood، إنه تكون الحي خدماته متكاملة وما يحتاجوا السكان الانتقال من حي إلى آخر للحصول على الخدمة. هذا تمرين حالياً عم نعمل عليه تخطيطياً، نشوف وين أولوياتنا بناء على التحليل السابق اللي حكينا عنه، حتى نتأكد إنه الخدمة الحاجة اليومية اللي بيحتاجها الفرد سواء من أماكن ترفيهية وفضاءات مفتوحة وقديش أهميتها بيّنت كمان زي ما حكى بالعرض الأولاني الزميل باتريك، إنه الفضاءات المفتوحة هي بتعزز قدرة المدينة على مواجهة الكوارث، مش بس الأوبئة. الفضاء المفتوح أو الأماكن المفتوحة كلها بدها إعادة دراسة لحتى تكون قابلة لإعادة الاستخدام، مش بس هي منطقة خضراء، لا هي كمان منطقة مفتوحة ممكن استخدامها في أي وقت طارئ، سواء لإنشاء مستشفيات ميدانية أو لأماكن إيواء في حال حدوث الزلازل لا سمح الله أو أي كارثة أخرى. فكل المعايير التخطيطية أصبحت بحاجة لإعادة دراسة وإعادة نظر، ومش بس المعيار التخطيطي، كمان المعيار التصميمي للخدمات الحضرية. أنا أنهيت ساندرا، شكرا كثير لكم. بطلب من الجميع شكرا. في كثير تفاصيل يعني إنهم يطلعوا عليها. التقرير نشر باللغة العربية ولكن قريبا جدا إن شاء الله، حاليا النسخة الإنجليزية قيد المراجعة سيتم إطلاقها، وبنحب نشارك المعلومات فيها الجميع كل حسب اختصاصه. شكرا كثير لكم. بتمنى أكون أعطيت فكرة هيك سريعة ومختصرة لأنه الوقت جدا ضيق عن مدينة عمان. شكرا.
Thank you, Nuha. We will address some of these issues further in our Q&A session and our panelist session also. I'd like to discuss some comments on the issues that Greater Amman municipality currently presented. So to do so, I'm going to turn over to Fuad Malkawi. Fuad is a senior urban development specialist and spatial planning community of practice leader at the World Bank. Fuad led the preparation of spatial plans and downtown revitalization plans for several major cities and city regions around the world. And he has advised several governments and international organizations on urban planning and management affairs. Fuad holds, he holds a PhD in urban and regional planning from the University of Pennsylvania. Fuad, in light of the presentation, could you please comment on Amman's urban response? And what do you think are the most pressing challenges cities like Amman are grappling with at the moment?
Thank you, Sandra, and thank you for inviting me to this very interesting discussion. I will try really to let's say, share my thoughts on the report which you shared with us after reading it, and based on really my also experience in Amman and other cities in the region. But in particular, my focus would be really on the response and how the city can probably advance its effort to reach out to, let's say, the larger part of the city in their fight against this pandemic. Now, keep in mind that the report has like about 200 pages, which actually not specifically about actually the response, but rather the response and some of the initiatives that started in the city prior to the response, like the resilience strategy probably and the climate change strategy that Nuha mentioned. So that's why probably the reader of the report would see that the report somehow moves between strategic outlook to detailed specific actions in response to the pandemic that are usually not really or should not be within the same report. But in all cases, the report presents really a good analytics that can be used to advance the planning initiatives in Amman in particular. The beginning of the report, of course, has all these quick fixes and actions that the city is taking in order to contain the pandemic. And these actually, we shouldn't really dwell on them because they are based on best practices, and I think the city is trying to do its best on that regard in terms of sanitization and the disinfection and all the efforts that the city should be doing, especially when we're talking about specific areas in the city. But I'll talk later that how these probably would need more of a spatial strategic focus rather than just a list of actions. But let me start really with the analytics that the report has, which are really very good start to a rethinking process that I will discuss a little bit here that the city should do. Of course, the report, the best part of the report and report analytics is about the accessibility that actually Noha probably ended discussing toward the end of her presentation. And it shows unfortunately, the analytics shows that accessibility is almost, or it's very limited in most neighborhoods, not necessarily specific neighborhood in particular. And when I say accessibility, I mean all amenities, not only grocery stores, not only baqala, but actually all amenities like health centers, and specifically accessibility to parks. And that is really one of the most urgent things that actually the city needs to tackle. And then the second part of the analysis, and I'll talk about actually accessibility later also, but the other part about the analysis, which is a little bit of the results of it is risky, is the financial analysis. If the pandemic wiped out most of the own source revenue, basically for the city, then the worry is how the city can continue to maintain its operations and the service provision, which are really critical in the next phase under the current situation. So if we go back to the analytics on accessibilities and on the public spaces and all these, they are really a good beginning to a rethinking process that the city should go through, in particular to its planning initiatives, targeting growth, distribution of amenities and public spaces, and accessibility, and etc., all of that. And why I'm saying rethinking process, I must apologize probably from the cynical tone of my voice, because these are the same things we talked about like 10 years ago and 20 years ago. Basically, if you look at the challenges highlighted in the analysis, they're the same challenges included in the master plan, which was prepared like more than 10 years ago. And even some of them are included in the master plan of the 80s. So the question becomes, why actually we are still not, why we don't have any progress on that? Why walkability, for example, which was the core of the previous master plan with its densification and intensification, is still a challenge here? Why provision of public spaces within the city to reach acceptable ratio, even one of the top priorities of the previous master plan and master plan before it, still a problematic issue today? In my opinion, I can even go bigger than that, with questions that are bigger than this. Why planning does not work actually in the city? Probably that is the question that the city should look into and start looking, really rethinking the whole planning process that the city is going through. There, some of the recommendations I've seen in the report included revising the master plan, and actually adding another recommendation is talking about a 40-year comprehensive plan, which to me are not really appropriate recommendations. Rethinking planning and having more strategic approach, basically to metropolitan spatial planning and focusing more on community planning, probably would be the proper recommendation. And it has been probably a desired outcome for a long time. So, this is not the place to talk about political will and planning actors. I think I've done that in many of my writings, those who read it in the past. But from a technical perspective, I think the whole approach, what the plans are focusing on and what type of planning we are bringing to the city should be the next step that Amman should take and rethink its planning initiatives or its planning approach. So let me go back to the pandemic and actually probably share my thought what more the city can do, basically. You know, in general, there are critical areas of interventions to mitigate the impacts of COVID that cities should take. Cities should first guarantee the continuity of operation and service provision, which Amman is trying to focus, and the response is focused on that. And second, put place measures that will mitigate the impacts of the most vulnerable populations and the urban poor. Unfortunately, I haven't seen what the city is doing in that regard in that report. And we know actually that a large percentage of the population in certain areas in Amman are under that category. And third, put in place recovery plans for the short, medium, and long-term planning. Amman has the opportunity to start planning for recovery while still responding to the current situation. The urgent responses that Amman is taking now and are being implemented still needs also to include a spatial dimension. All these analytics are good, but they need to be brought into the fight of the pandemics. So for example, the use of spatial data of the city in prevention support is still limited. There are methods by which the next area of outbreak would be expected, hotspot analysis and other methods. The effectiveness of measures can be virtually tested using spatial analysis. Amman has a great capacity in actually spatial analysis and digital information. In that particular thing, it can be of a great support to the national effort actually to contain the pandemic. The second thing, the spatial analysis can show how different areas in Amman can respond. In particular, when we are talking about dense areas and informal settlements, which were actually mentioned in Patrick's presentation, they are potential hotspots. So actually the spatial data that Amman has can provide more effective response if it is actually aggregated by the spatial distribution of the population and other data that Noah talked about. And finally, third, short and medium-term recovery plans can perhaps provide quick opportunities for cash-based work in less fortunate areas. Many of the cities where I work in, the city itself is providing these quick projects where they provide cash for the vulnerable groups that we are talking about by actually more or less having or hiring, let's say, unskilled labor in these areas. So on the long term, I go back to the fact that Amman needs to put recovery plans in place immediately. We cannot just say we will plan. I think now it's the time to have a recovery plan for the coming couple of years. And everybody knows that actually the economic crisis is gonna last for some time. So the cities are actually putting recovery plans right now. Then also I go back to the point of Amman needs to rethink its planning system and have better functioning planning system that produces more implementable plans in the city. The new approach to planning should rather be strategic, as I said earlier. A new master plan is not a solution. Translating strategic plans into actions in a changing environment like Amman depends highly on the capacity of the planners. So investments in the capacity of the planners is part of the quick fix. Now, third, Amman needs to consider new approaches to public space design. By the way, I was reading the comments and a lot of people commented on that, with emphasis on resilience. This would require comprehensive rezoning scheme, not simply statements about standards and the balcony to be added to the building the way the report is saying, but rather really a whole rezoning scheme that actually looks at different areas and see how we can increase the ratio of public space in a quick way, not wait until we have a master plan to do that. And fourth, Amman needs to have more public space to allow for movement and enjoyment. this has implications. It's not about actually finding a piece of land. It has the following implications: less corridors for cars, which would require effort to reduce the number of cars in the city, and better transit system that is efficient and allows distances and proper disinfection. I think that is the meaning of having more public space. It means actually less reliance on car and actually having more space for people. Finally, I'm ensuring the stability of municipal operating budgets will be key to continuing the provision of municipal services, and most likely the increase in coverage as needed to respond to the crisis. The figures that Noha presented are very alarming. So this is actually one of the priorities should be right now, how to increase the own source revenues in order for the city to be able to continue its operations. So let me conclude by a statement which is no planning for future pandemics is a very high risk. We need to plan for the future. If we are missing this opportunity, it's going to be a big disaster in the future crisis. Thank you very much.
Thank you, Fuad, for this insightful commentary and on really bringing to forth rudimentary issues that we need to question moving on forward. I would like to move to the second part of our session today, but given our time limitations, what I will do as part of our next panel discussion is pose 2 questions and ask the speakers to very briefly answer them within the course of 2 minutes, so we can move forward and address the questions that our audience has been sending. So the first question is that we've seen the municipality reversing its focus towards neighborhood planning. What do you think is the suitable scale for planning in a city like Amman? And is planning on a larger scale, metropolitan scale, feasible at this point? Fuad, you addressed this in part, but it's really good to bring forth this question of scale. Another question is that city administrations are constantly facing the question of where do they direct urban growth? Do they expand in the peripheries or contain growth within the city's current boundaries? Is there a dichotomy between these 2 growth patterns? And where do you see urban growth directed post-pandemic? I would like to perhaps ask Patrick to please address these questions first.
Great. How much time should I take to address? 2 minutes, did you say?
Yes, please.
Okay, great. Very, very happy to do that. Thanks to all of the speakers. All of these presentations were very interesting. As I say, it's a city that I don't know much about, but I can bring the view from 30,000 feet. On the topic of the scale of planning, you know, I think it's important that we understand what planning is for and what planning can and can't do. And this comes down to the key idea of what cities are for and how cities work. So the reason why people come together in cities, as I'm sure we all know, is because of the productive benefits of metropolitan labor markets that make it possible for people to be so much more generative in these places and lead to so much more production and productivity. Everything else that we do in cities kind of lives off of that labor market. If you take away the labor market, it doesn't matter if you have an opera, and you can look at cities like Detroit and see that that's true. So when we think about the scale of planning, we have to think about it at the scale of the metropolitan labor market, because that's really the functional area of the city. That's where workers are connected with firms, and it's that activity that makes it possible to have a city at all. Like, that's what attracts people to the city. It's not the only thing that's going on. It's not even really the majority of what's going on, but if you take that away, the city dies. So you have to think at the metropolitan scale, but that's different from where you act. So you take a metropolitan lens and then neighborhood interventions, because what you're trying to do is build the city up as strategic units, like functioning units that correspond to how people actually live their lives, recognizing the fact that people spend a portion of their time, probably the part of their time that's most important to them, in their neighborhood, and then they spend the rest of their time outside their neighborhood doing the activity that actually makes the city function. So that's my answer to scale. You always have to think metropolitan and act on the neighborhood scale. It's the think global, act local, but in a city. On the question of expansion versus densification, so these things are often framed as being in conflict with each other. This is a planner's fantasy. In reality, cities grow through expansion and densification. And we know from looking at cities around the world that in the last 25 years, this is a real statistic, 77% of the population growth in cities has been accommodated through expansion. And that includes cities in the developed world that aren't even expanding very much. So only 23% has been accommodated through densification.
فقط تم استضافتهم من خلال ذلك. Sorry.
So if you want to think seriously about growth, you have to think seriously about how to accommodate expansion and densification, and understand that densification is only going to accommodate a small portion of your expansion, of your population growth. It's only going to accommodate a small portion of your population growth unless your city is a real outlier. And this isn't like me, critically interrogating the process of planning in Amman. This is just data. There are almost no cities on earth that are succeeding in accommodating the majority of their population growth through densification. And there are no cities on earth that we've been able to detect that are actually shrinking in area or staying the same size. Every city on earth, even cities that are losing population, are still expanding in area. So you have to think seriously about expansion. And as far as where it should go, the informal sector will tell you exactly where growth wants to go. Go and look at where the informal settlements are being built. That's the area that's most attractive for growth. What we have to do as planners is try to use public space, roads and open spaces. We have to use public space to guide what happens in the private spaces. So, and we have to do that before development happens. The idea of coming back in later and making new public spaces and more public spaces, this is like the most costly and inefficient way to do this. It's so much cheaper and easier if you plan before the growth happens. So again, that's a metropolitan analysis implemented at the neighborhood scale. Densification and expansion, you really can't choose densification. If you just choose densification, you're just going to get all your expansion in informal settlements. It'll be a total mess. You have to do both.
Thanks, Patrick. Nuha, can you please briefly answer the questions? I would like to just address to everyone that we're going to be running an extra 10 to 15 minutes over the original timing, so please bear with us. Nuha?
Okay. شكرا ساندرا. أنا حابة أشكر الدكتور فؤاد على ملاحظاته. يمكن بدي أسبوع متصل من الكلام أجيبه على النقاط اللي أثارها حول التخطيط في عمان، الخطط السابقة وين راحت، كيف تنفذت، إيش اللي منها تم وإيش اللي ما تم، إيش الإجراءات اللي صارت عليه. ففعلا هي يعني بتثير هاي الأسئلة، فإن شاء الله لنا لقاء ونحكي بالتفاصيل إيش صار في الخطط السابقة وإيش الإجراءات اللي اتخذتها الأمانة، وين التحولات أو نقاط التحولات اللي صارت في تنفيذ الخطط. بالنسبة للأسئلة، طبعاً أنا بأيد اللي حكاه باتريك. هو لا يمكن إنه بس نخطط على سكيل صغير وننسى السكيل الكبير. كل مستوى المتروبوليتان له غاياته في التخطيط، والسكيل الأصغر اللي هو على مستوى الكوميونتي أو على مستوى الأحياء كمان له غاية اللي هي بالآخر الإند يوزر، المواطن بده يستعملها. فزي ما لما نخطط على مستوى وطني بنحكي هذا دور المدينة الكبرى بالنسبة للمدن المجاورة إلها، نفس الشيء كل حي في له علاقة بالحي المجاور ضمن المدينة الكبيرة. فالتخطيط لا يمكن إنه يكون بس بمستوى واحد. يعني حتى كل الخطط السابقة وضعت على عمان كانت تشتغل بالاتجاهين. فيمكن أنت تيجي تحكي في مدينة فيها لها وظائف وفيها ناس شغالة وتشتغل بمقياسين مختلفين، ولكن الغاية من كل سكيل هي تختلف. لما نيجي نحكي عن خدمة، لازم خدمة يومية للمواطن، يبقى أنا بحكي عن community scale. لما بحكي عن إشي اقتصادي وكبير وعلى مستوى المدينة، يبقى بحكي أنا على مستوى المتروبوليتان. لا يمكن نفصل هدول المستويين عن بعض، هم بالاتجاهين مستويين متداخلين، لازم يكون في بينهم تكامل، وإلا ما بنجحوا. إذا ما بيشتغلوا مع بعض لا يمكن ينجحوا بالآخر. بالنسبة للسؤال الثاني تاع نمو المدينة والحد من نمو المدينة، المدينة كائن حي، يعني لا يمكن نتعامل معها إنه إحنا بنحط لها أسوار وبنحط لها حدود ونقول أنتوا لهون ومن هون بعد هيك لا ما بصير. مدينة كائن حي هي تتصرف أحياناً بطبيعتها مع وجود محددات من التدخلات اللي المخططين بيعملوها. بمدينة عمان بالذات في ضوابط أو عوامل تانية بتأثر بنمو المدينة. أول عامل اللي هو الملكية الخاصة. الأراضي معظمها إذا مش 95% هي مملوكة للأفراد. حرية التصرف بالملكية مضمونة عندنا بالدستور. فمش كتير أنت ممكن تضبط عملية النمو الحضري طالما أنت ما عندك القدرة إنه أنت تأمن ملكيات وتعمل مشاريع التنموية الحضرية اللي أنت بتنظر إلها كمدينة إنها لازمة لنمو المدينة. العامل الثاني والأهم اللي هو كمان مرتبط في الأراضي اللي هي القدرة أو الأفوردابيليتي على شراء الأرض أو شراء المسكن في المكان اللي إحنا بنشوفه كمخططين مناسب للنمو الحضري. العامل الآخر اللي هو عامل الخدمات. مش كل الخدمات البنية التحتية تحت سلطة البلدية أو تحت سلطة الأماني. لما نحكي الكهرباء والمي مش تابعين إلنا وما فيش هالتكاملية في التخطيط ما بين المؤسسات الخدمات الأخرى والبلدية نظراً لغياب تخطيط خليني أحكي أعلى على مستوى متروبوليتان أو على مستوى حتى وطني، ما رح تتوافق هدول الاتجاهين. إذا ما صار في نظرة لتوفر الخدمات قبل وجود النمو الحضري ما رح يكون التنين متفقين. فالنمو إذا بدك أنت تحكمه لازم كل مدخلاته تكون موجودة فيه. إحنا قدر الإمكان بنحاول إنه نوجه النمو على الأماكن الأفضل والابتعاد عن الأماكن الثانية اللي إحنا بنشوف إنها مش مناسب يصير فيها نمو حضري، لحتى إحنا كمان نقدر إن نخدمها ونؤدي الخدمات المطلوبة منا كمدينة. ولكن مش كل الضوابط تحت سلطتنا وإمرتنا، وهذا تحدي صراحة في أمانة عمان. وإن شاء الله إنه مع تعديل القوانين والأنظمة إنه تصير المدينة هي تحكم ذاتها بما تحوي من خدمات بنى تحتية، من نقل وتنقل، من خدمات حضرية، من مدارس، خدمات تعليمية، خدمات صحية. إحنا حكينا خلال العرض عن وجود معايير لوضع هاي الأشياء، ولكن هي مش بالكامل تحت سلطة البلدية. هذا بالمختصر، ولكن الموضوع شيق يعني يأخذ من الوقت طويلا جدا للنقاش خاصة المخططين. يعني ما دائما في ديبيت وهذا الإشي صحي يعني الصراحة.
شكرا لك فؤاد. بتحب thank you Fuad. Would you like to address the questions?
Yes, thank you. You know, Amman, I mean, I noticed that Patrick works in Mumbai and I work in Calcutta and Chennai, which are probably the most populous cities in the world, basically. But both of them are probably easier to work in than Amman. What Amman has witnessed over the past 10 years is unprecedented. It's as simple as that. So there is no model of planning that you can think of and you can come and say, you know what, this is how we're gonna be doing it in Amman. I mean, I would be surprised anyway if the previous master plan is already implemented, which mostly not. But if it's already implemented, because all the factors on the ground have changed by actually a couple of crises in the region over the past 10 years. So when we think about Amman, it's not about which model we choose. It's about actually what is going to be the approach for a city that is actually in the middle of a region that is continuously affected by different crises, and add to that the last crisis now, which is the pandemic. So there is no really a model that can be brought in and really and we expect it to work. But what I was saying in my intervention is even the previous model, before these crisis, didn't work. It's as simple as that, because we're still actually asking for the same things that we worked before. And the previous one model looked at the metro level, basically, and produced a growth strategy for the metro level, and then went into the area and community level. But it didn't work. Why? There was the issue of governance, which actually also another problem in Jordan. I mean, Noha knows that the city expanded probably 3 times and then shrinked again and then expanded. Amalgamation was taking place every couple of years or so. So that's why I didn't really propose a model. I said, this rethinking process should start now. So here I actually support what Patrick said. Really, we should be more focused on the community level and what the community needs and how we can cater for that need. We can still look strategically at the metropolitan level, but actually we expect the metropolitan level to change, not only because of crisis, but because actually of the expansion that the city is witnessing for various reasons that this is not the place to discuss. That's why we get to the community level. If we have a larger strategy and we start thinking of the various communities about their needs and start to cater for them. And this is what I was saying in my intervention. And by that, we start looking at communities based on the data that Noha shared part of, and I know the city had, like vulnerable communities. When we go, I read one of the comments where she said her daughter cannot get to a park by walking. And that is a big problem, because it's not a big problem only for the people. It's a big problem because that means we are highly depending on motorized movement, on cars. So to get to a park, I have to drive. To walk, I have to drive somewhere to walk. That's another issue. So to me, the rethinking process should start from that scale. What do we need in our neighborhoods? How we can distribute actually these facilities in the neighborhoods? We don't want any more grand plans, basically similar to the ones we had like 10 years ago and 20 or 30 years ago, because we are now sure that actually these will not get us anywhere. We still need the strategy at the metropolitan level, because there are a lot of issues that are critical that needs to be taken. I think that's the core of what I was arguing, and that's actually what I think the city should start doing. And that's why I emphasize the capacity of the planners, because when you don't have grand plans, it's the planners of the city who are responsible for making sure that these communities basically are getting the facilities that you need.
Thank you, Fuad. And it's quite remarkable what you and other speakers are saying, especially you've been on the end where you evaluated the outcome of the 1989 master plan, and you witnessed the city throughout these years. So to come out with this conclusion is pretty substantial. I would like to now move to the Q&A. We will, for the sake of brevity, I will be fielding 2 questions over 2 rounds, a maximum of 2 rounds. I would like to remind everyone to please place your questions in the Q&A box and not in the chat box, in order that we be able to address them. So the first question basically comes from Susan Razaz, our colleague here at IGC, and she addresses the issue of crowding and how it negatively impacts transmission. So basically, what she says, A, is she's suspecting that data on crowding within Amman is not easily available. And however, she imagines that exists for public transportation on public buses. So is there any information on that front to understand how much crowding we have on buses? And that question is addressed to Naha. Question to Patrick is, what is known internationally about the extent to which crowding on public transportation has been an issue in transmission? The other question is from Baghdad, and our Zoom user, unfortunately, there's no name there. He or she is asking, do you think Amman was able to control over the spread of the virus? And if so, what would have been the main factors? So perhaps we can start with you, Naha, very briefly, please move on to Patrick, and perhaps Fuad, you can address the last question.
أوكي ساندرا، بالنسبة للسؤال الأول، البيانات موجودة. المفروض إنه عند دائرة الإحصاءات، يعني إحنا ما حسبناها، بس في يعني قاعدة بيانات ممكن إحنا الأمان إذا صار لنا أكسس عليها إن نستفيد منها ونطلع معدل الكراودنس اللي موجود بعمان. أنا كمان بالمناسبة يعني كونه تاحت الفرصة، حالياً عمالنا نعمل تحليل عشان نطلع بأثر الحضري على مواقع الهوت سبوتس في عمان. كنا عم نحكي هلأ عن موضوع الكثافة، عمالنا ننزل مواقع الإصابات اللي عمالها تتسجل. طبعاً إحنا اللي لنا أكسس عليها عم نسجلها، تعاون مع المركز الوطني ناخد عناوين، لأنه الصحة حالياً تاخد عناوين كل الإصابات اللي بالكوفيد 19، ناخدها ونعملها مابينج ونقارنها مع الخرائط اللي حكينا عنها، مع خرائط الكثافة، مع خرائط الخدمات الصرف الصحي، الخدمات البنى الحضرية الموجودة الثانية، لحتى نشوف إيش الأثر، هل فعلا يعني وين كانت الهوت سبوتس وإيش اللي موجود تخطيطيا هناك، لحتى نطلع بنتيجة محلية لا عمان قياسية، نعرف إيش التدخلات اللي لازم نعملها تخطيطيا لحتى نحد من انتشار الوباء، وين كان أثر تخطيط المدينة على انتشار الوباء. يمكن هذا شوية دخل على الخط الثاني. فالإجابة إنه بإمكاننا نطلع بهاي الأرقام. إحنا ما حسبنا الكراودنس الصراحة بعمان، بس في أرقام متوفرة عند الإحصاءات، يعني إذا أخذنا أكسس عليها ممكن بسهولة نطلع بالرقم باستخدام التولز اللي موجودة عندنا والGIS مابس، لأنه هم لما عملوا تعداد السكاني كان كثير دقيق، يعني على كل بيت قديش فيه وحتى عدد المساكن والشقق، فسهل جدا إذا أخذنا هاي البيانات نطلع بهذا الرقم. بالنسبة للسؤال الثاني اللي هو من بغداد، أعتقد من أمانة بغداد، هلأ الأمانة في البداية حدت من انتشار الوباء بالإجراءات اللي تم اتخاذها وإجراءات التعقيم، لأنه زي ما بنعرف في بدايات الوباء ما كان لسه حتى معروف كتير إيش سبل الانتقال تبعته. اتجهت الأمانة لتعقيم الشوارع وأسطح المباني وإغلاق الحدائق وإلى آخره، وآلية خاصة للتعامل مع النفايات لحتى ما ينتقل الوباء. وفعلا يعني ما صار في إصابات ما بين، حتى لما انتشرت صار في أعداد إصابات في عمان، ما كان في إصابات ما بين خلينا نحكي العاملين، وعمان كانت أقل المدن انتشاراً. كان في بؤرة معينة موجود فيها المرض، ولكن انتشار على مستوى المدينة ما كان بهذا الانتشار. وإذا قرناها بالمدن الأخرى بالأردن زي إربد، كيف كان انتشار واسع للمرض في فترة ما. حالياً المملكة كلياتها بتتعرض لهذا الانتشار. فإحنا الإجراءات اللي كانت تحت سلطة الأمان اللي اتخذتها، أولاً إحنا تحت يعني حدينا من وصول المراجعين عن طريق خدمات إلكترونية. يعني في إجراءات كثيرة، يمكن أنا بطلب منهم الاطلاع إيش الإجراء بالضبط اللي تم، اللي هو موجود بالريبورت الطويل زي ما حكى الدكتور فؤاد بالتفصيل.
Thank you, Naha. Patrick and Fuad, can we please briefly address the questions?
Great. Well, my answer is fairly brief, which is that there's very limited evidence of transmission of COVID-19 on public transportation, provided people are wearing masks. So one of the things that we haven't seen, for example, is we haven't seen super spreader events that are driven by public transportation. The challenge that municipalities are facing now is that this information isn't very widespread, so people are reluctant to use public transportation. And it's also coming at a time when, like, probably to me, the most important part of the presentation of NUA was talking about the crisis in municipal finance. So it's going to become increasingly challenging to maintain good levels of service on public transportation because fare box revenues are way down, and also the revenues to subsidize it are way down. So COVID-19, maybe not the problem. The bigger problem is maintaining service levels in this deteriorating fiscal environment.
Fuad?
Sandra, can you repeat the question, please? I mean, I'm kind of lost now.
Actually, I will mention the question and other questions, so perhaps you can field them at the same time too. We have had a few questions appearing in our chat box, so it's been pretty, I'll try to field as many of them as I can. One of them is coming from Rima Ode from the municipality. Basically, she asks about if you can share a few examples so that the municipality can take a look at. We have also previous Mayor Omar Maani discussing a little bit about, he mentions the question of public transportation, and since it was viable in reducing air quality substantially, it's more of a comment, sorry. It's going to become more of a important social, and finding a mass mobility scheme is more important at the moment socially and economically, and perhaps you can address that. We also have a question from Uhud Kamal addressing private property issues that GAM is facing, and some NGOs facing difficulties in reappropriating existing parks and making public spaces more viable. And she alludes to the structural changes that you're addressing, but perhaps we can address this question to other speakers as well.
Okay, so I mean, there are really many examples from which Amman can have some benefits. Basically, the bank actually has a continuous webinars hosting city mayors of cities that successfully contained. We had, I mean, I cannot say successfully. Let's say cities that dealt with this crisis in certain aspects, and actually the failure and success of each city. So you can look at probably Singapore as a good example, and probably look at London as a difficult example. So there are several cities from which Amman can learn. But to me, basically, the Amman situation should also be kind of, I mean, there are a lot of simple things that can be done, and I alluded to that, where, I mean, I think the report shows that they're doing a lot. So actually adding this spatial dimension can probably help, and probably the analysis of where we can identify areas where we need action as soon as possible can help. Now, on the public transport, I cannot but agree with two things. First, as the comment said, this is actually the future. It is important for us now to see how we can reduce the number of cars in streets, and if we don't want the city to expand and rather really use the space of the city, then that means we need more spaces for people, less spaces for cars. And that is actually a grand scheme. The other thing, as Patrick said, there is no indication really that public transit is a contagion place. So there are a lot of measures that are done. They're doing that all over the world, the disinfection and the social distancing and all these kind of things. But the problem, there is a cost implication on all of that. And that is where the revenues of the city become very important, because there is a large investments that need to take place. And with a city that with a shrinking on source revenue is problematic to achieve these actually, or to do these plans that to invest more in public transit. Thanks.
Thank you, Fuad. I just want to clarify that Rima is offering to share further work that the GAM has conducted on that front, rather than questioning case studies. But we're in a knowledge sharing session, so knowledge sharing can go either way. Patrick and Nuha, would you like to comment, please, on the questions?
On the same question that Fuad commented on?
Yeah, the bunch of questions that I posed, would you like me to rehash any of them, or?
Could you briefly summarize? That would be
Okay.
great. I'm so sorry.
So sorry, it's a goose chase following questions here. but one had to do basically with public transportation, and basically it has proven itself viable socially and economy in addressing the issue of crowding. So perhaps if you would like to speak towards that end.
It seems to me like there are a couple of issues with public transportation in a general sense. So, you know, several times in this presentation, people have mentioned that Amman is a car city and that it's designed for cars. I don't know the data specifically, but I imagine that there are many people in Amman who don't have cars, and that there are probably a lot of people for whom Amman is a walking city. So for those people, the only way for them to participate in the metropolitan economy in a meaningful way is through public transportation, because otherwise they're limited to their neighborhoods. And I know that the self-sufficient neighborhood concept is something that is held dear by a lot of people, the idea of the 15-minute city, but practically speaking, this makes it harder for people to become integrated, especially if they're living in informal areas. So when we think of the public transportation system, we really have to think of it as a vehicle for upward mobility, not just a mobility tool, but a vehicle for upward mobility for people who otherwise would be living in a much smaller walking city. So that means that routes need to be designed with that in mind, and service needs to be provided with that in mind. Service needs to be corresponding to the hours that people are working. It needs to be going to the areas where people really need subsidized transportation, instead of putting them in the position of having to use the informal transportation network, which can be more costly, but offers service when they need it. Now, in the context of the pandemic, again, this is really comes down to financing, because fare box revenues are going to be low for a long time. Like, it's going to be a while before public transportation recovers in terms of fare box revenues. And in many places, I think among them, the fare box revenues aren't even priced in a way that covers the cost of the public transportation. So even if you have every bus completely full, you lose money on every run, right? So this is actually a great social justice strategy, because it keeps the transportation system affordable. But as far as building something that's sustainable and scalable, it kills you, because it means that from the standpoint of the municipality, every extension of the system is just a cost. There's no benefit to it. So eventually those fare box revenues have to cover the actual cost. But for now, it's going to take subsidy, and most likely subsidy from the center, because municipal owned revenues are crashing. That's my take on that.
Thank you, Patrick. Unfortunately, we have overrun our time, so I would need to end the session at the moment. I would like to ask everybody to please fill in the survey. Once we exit this Zoom session, you're going to automatically receive a survey. So it's going to take only 2-3 minutes. So please, we would appreciate if you fill it. Additionally, my colleague Musa is sharing a study that we have recently completed at the IGC by a group of colleagues on the economic impacts of COVID-19, and it addresses questions of mobility. So please take a look at that. I would like to end by thanking my speakers for their time and for their valuable insights. They're entering across different time zones and joining us today. So thank you for waking up early today, but more importantly, with really creating a lively debate around the issues that we have discussed. Bye-bye, everyone.
Thank you.
Thank you. Thank you, Sandra.